Good evening to each one of you who has joined today, and welcome back to yet another episode of our Polaris Talks. I'm so glad that this keeps happening every Monday, Wednesday, and Fridays at 6:30 p.m. That we have an opportunity to discuss a lot of topics with our dear students, and as promised and as happening before, we'll be doing general anatomy today, and it will be a discussion on the topic bones. So, for that, I would like to welcome our dear panelists today, Dr. Sanjit Bajpayee, Chief Academic Officer at Dr. Polaris. Hi, sir. Good evening.
Yeah, good evening, Aishwarya. I'm just
How-
trying to share my screen.
Okay, sir. Okay, sir. I think it's
Yeah,
not still clear. Is
yeah.
it?
Can you see my screen?
Yes, sir. Right now, it is visible.
Yeah, yeah. Is it okay now?
Yes, it is.
Yeah, okay.
So, all ready to move forward, right, sir?
Yeah, I'm ready. So I hope all the students are ready because today is one of the most difficult topics to understand. And at the same time, I would say it is one of those topics which students have a lot of problems in understanding in the beginning part. And this is the core of anatomy because when we have skeleton with us, we need to understand each and everything about the skeleton and then go into the bones separately. So that is how it is. So I think we are ready to go. So if I have the opportunity to start, I can straight away start.
All right, sir. Great. Please. Over to
Right?
you.
Okay.
Yes, yes.
Fine. So very good evening to all of you. And whoever is present here, first, let me tell you what exactly I'm going to do today. So the anatomy of bone has to be divided separately into two segments in order to understand it fully. So what I'm going to tell you today is the basic core concepts of what is a bone. Okay. And in the next segment, we would be taking up histology of bone, which will cover up the microscopic anatomy of the bone. But today, my whole focus will be to generally orient you to this particular topic. What exactly is a bone? Right? Fine. So let's make your concepts and bones stronger. That would be my whole advice to you by the end of this webinar, that you are very friendly with the skeleton that you have next to you. Okay, fine. So let's proceed with this particular anatomy of bone. Now, when we see the anatomy syllabus, this is the particular scenario of a first year medical student. When we enter, we have got this huge bull standing in front of us, and we don't know what exactly has to be done with it. But by the end of first year, you should be able to tame this bull. You should be able to sit on top of it, ride it, and tame it. That is what you have to get the core concept of anatomy in your hand. And that is what I'm going to teach you today. How to get that? What are the tricks of understanding it? Okay, fine. So, would you like to be my friend is the first question that a skeleton poses to you. And you know there are 206 bones in the human body, but how exactly these bones are formed? What is the core structure of that bone? How exactly a bone is helping us? And if something goes wrong with that bone, how will it present to you? That is what we are going to see one by one. Right. Now, let me first introduce you to certain terminologies whenever we are reading anatomy regarding to bones. So the first thing is why a skeleton is named a skeleton. It is derived from a Greek word called skeletos, and skeletos means dried body. Now let me be very clear to you right now. Whenever we read anatomy in our dissection labs or in our classrooms, we read the anatomy of dead bones. And when we are on our day-to-day life and we are going around, we are basically made of living bones. So there are very much differences between what a dead bone is and what a living bone is. So what I'm going to discuss is about living bones with you. Then I'm going to tell you what is the difference and what things are not seen in dead bones. Right? Okay. Now, what is osteology? Osteology, as we know, that it is one of the segments that has been given to you. It is the studies of bones of the human body. That's called as osteology. Now, why exactly it is called osteology? Because it has been taken from the Greek word osteon, or you can also say a Latin word which just means os. So wherever you find these terms, os, osteon, we are all talking about bones. Okay, you will find such terms. There is a bone that is called as os trigonum. That is a triangular shaped bone in the talus. Why it is called os trigonum? You will ask me. Os is a bone in the talus, so we call it trigonum. Okay, so these have been derived from these two important derivations, from Latin as well as from Greek. Okay, Now we come to certain facts. Now, what is a bone? First thing, you should understand that a bone is a connective tissue. It is a type of connective tissue. And it forms 1/3 of the connective tissue that is present all over in our body. That is a huge thing, right? Now, out of this whole connective tissue, 2/3 of the bone is hard and rigid. And the remaining part of the bone is flexible and tough. Now, how it is hard and rigid, why it is flexible and tough? The hard part of any particular bone in our body is basically rich in calcium salts. To be specific, calcium carbonate, calcium phosphate, the two most important salts that make the bones. That is making 2/3 of the bone, and this is responsible for giving it a very hard architecture as well as rigidity. So when we say what is the part of the bone which is protecting us, it is this mineralized part of the bone. That is why we call it mineralized, because it contains minerals, because it is making so hard, right? That is the reason you have been protected by this, by these calcium salts. Now the other part comes, we even bend, we even go and do certain activities which takes a lot of shear forces. How do we do that? That is because of the other element that is present inside our bones, that is basically the collagen fibers. Okay, that makes it flexible and tough at the same time. So these are the two things that make up the bony matrix. Okay, fine. Now, what exactly is the function of bones? This is a very common question that is asked to you in your vivas. Okay, any person will ask you, what exactly is the function? Why you want this bone to be there? Okay, so I made a very simple mnemonic. Indian medical students love ATP. This is how you can see mnemonics are something. First, you need to understand and then you need to finally memorize it, because anatomy you need to understand and finally memorize. This is how anatomy is. You have to memorize by the end of the day. So how to keep those facts inside your brain and how to memorize it, I've given you some simple mnemonics all throughout this webinar. So Indian medical students love ATP. So what does a bone do? I is for immunity. So bones have something called as bone marrow. That is, I'll tell you what is a bone marrow later on, but they have something called as a bone marrow inside each bone. Endothelial cells. Now, just in order to be very simple, reticuloendothelial cells are the cells which are giving an immune response. These are the cells, whichever infection happens inside a body, these are the cells which go and they will eat up that infection and will generate an immune response in our body. Just remember like that. Okay, this is the I. Now comes M, that is medical, then students. So M is manufacturer. So any bone in our body is a manufacturer of what? Of bone marrow. And what does our bone marrow do? It produces hemopoiesis. Now, what is hemopoiesis? Hemo means blood, right? And poiesis means secretion of certain cells. So if suppose blood cells are released, that is being called as hemopoiesis. And what do red cells do? They basically maintain our hemoglobin levels. Red cells carry oxygen. The more the hemoglobin, the more the oxygen carrying capacity, right? So it is a manufacturer of our bone marrow, which is also very important. Now comes S, students. So it ends and starts both with S. So there are two S here. One S is storage. It stores. And what does it store? It stores the calcium of the body. It has a calcium store. So we have two stores inside our body that store calcium. One is the blood, which is the free calcium, and one, the extra calcium. Whenever there is extra calcium inside the body, it goes to the bone and stores there. That is why we call it the bone store of calcium. So it stores calcium salts. Okay, right. Now, it also ends up with an S. So that is, it gives you shape and support. That we already know. It's self-explanatory, right? Okay. And then comes love ATP. So L for love is what? It acts as a lever. So all the muscles are finally attaching somewhere. Once the muscle is attaching to a bone, it attaches by something called as a tendon. So a tendon attaches a muscle to a bone. Okay, that we know about it. Now, whenever we are moving or whenever we are creating simple functions, these things act as levers so that our basic body functions are easily carried. Right? That is why the L comes here. Now comes A, T, and P. So what is A? It gives attachment to muscles of our body. T, it gives timbre to our voice. Now, suppose I'm talking to you. There are certain bones which are present over here in my skeleton, in my facial skeleton. These bones are filled with air. That is why we call them pneumatic bones, or we call them sinuses. I'm going to tell you later on. But because of these air-filled bones, whenever I'm talking to you, my nose has, or my voice has a certain nasal timbre to it, right? That is the reason you've been given sinuses, to give that timbre to your voice and to even give humidification to your air, whatever you are inhaling in. That is why they have been given to you, these sinuses or the paranasal sinuses. Okay, so that becomes T, or timbre of voice, and the last is P, that is protection. Very important. All our structures that there is a bone outside are importantly preserving or protecting our organs or viscera inside. What is a viscera? Viscera means organs. So all our organs, let's say there is lungs or heart, they have been protected by our rib cage, the sternum. So they are protecting very important organs beneath it. Okay, so these are the important functions of bone. Right, now here itself I'll come to you and I would tell you that this particular chapter is very haphazardly given in your textbooks. Because once you go into a textbook, the starting of this chapter will be from classifications and they will take you to 10,000 things. Then finally, you will enter into this particular topic, the parts of a long bone, and you will finally understand it in the later part. So any person who's reading this chapter, my sweet and simple advice to all of you will be, whenever you're reading bone, read up the anatomy of the long bone first, then go into the classifications. Because in every textbook of anatomy, classifications are first. Whenever you open osteology, don't do that because you'll not understand it. You'll start mugging it up. Okay, so fine. So my first thing to talk about or to discuss about in a bone will be first discussing about the parts of a long bone. Now, this comes as a long question or an essay question to you in your first years. That is why I've started or made it into 4 stars. Favorite question of Vivas, favorite question of your examiners to ask as long questions. Describe the anatomy of a long bone. Okay, so how do you have to write it and what you have to draw? Open up your copies and start writing with me now. Okay, I want all of you to make your own notes and start writing with me now itself when I'm explaining. Right, okay, so any particular bone in our body has got different shapes and sizes, right? When we call a bone a long bone, that means the length of the bone is more than the width. So see, the length of the bone is more than the width. This is a traditional long bone of our body. Now let's take up what exactly is this. Each long bone of our body has got different parts. Okay, there is a stem or the center part of the bone. There are 2 ends of a bone, right? So the center part of the bone or the main bone where you just hold that, suppose this is my marker where you hold the bone or the marker from, this particular area of the bone is given the name as diaphysis. Now, why it is called diaphysis, that is also an important question. Dia means between, physis means growth. So anything that is in between growth, this particular thing is called as diaphysis. And diaphysis is basically also given the name as shaft of the bone. So suppose if you're given a humerus in hand, or a femur in hand, or a tibia in hand, the area where you'll hold the bone from will be this diaphysis or the shaft of the bone. Okay, fine. Now, your bones inside the body, they have to form with years of life. They are not formed right from the beginning since you're born. They form with years as soon as you grow older, right? So these bones get formed by certain centers. And these centers are called as ossification centers. Now, don't get confused. I'm going to tell you each and every detail about these centers. Just remember, bones are forming from centers, and these centers are called as ossification centers. Now, there are 2 types of ossification centers. One center is basically those which form before birth. One center is which form after birth. That means there are certain centers which are forming the bones before birth. There are certain centers which start forming later on in life. Diaphysis or the shaft is the area where you have primary bone center or primary ossification center. This center is formed before life. I already told you. So whenever you will see a newborn, you will always see that the diaphysis of the newborn is already formed. But the secondary centers, what we say, they are formed after birth. They are found over on the other 2 ends of the bone. So that is why the ends of the bone grow later in life, but the shaft or the whole diaphysis is already formed as soon as the baby is born, right? And because of the fact that it has got a primary center. So secondary centers are formed at the ends of the bone. Primary center is formed at the center or the shaft of the bone. Now, this particular shaft has got a very important type of bone that it is composed of. Now I'm introducing two important terms to you: compact bone and a cancellous bone. Now, what do you mean by these terms? First, let me be clear. The ends of the bone are made of cancellous bones. That means if I'm talking about this end of the bone and this end of the bone, they are made up of cancellous bones. Cancellous bones means spongy bones. Have you seen a foam? The same foam has got multiple pores in it. It is a sponge, we call it. The same sponge is present at the ends of the bone, any bone you take. The ends, if that bone has got ends, it will be spongy. And this particular center diaphysis or the shaft will be composed of a very hard bone that is called as compact bone. Okay, so compact bone is present in the shaft. Spongy or cancellous bone is present on the ends of the bone, right? Now, this particular shaft or this particular diaphysis has got a cavity in the center. I'm going to tell you each and everything about this shaft and cavity also. Just hold on like this. This shaft or cavity of this bone is called as medullary cavity. Okay, what is the literal meaning of medulla? Medulla means inside. That is why it has been given the name medullary or medullary cavity, right? Cavity means a space. So if I talk about the shaft, in simple words, diaphysis is also called as shaft. It is the primary center from which the bone starts forming before birth. It is composed of a compact bone, which is a hard and dense bone, which is ivory hard and rigid. And it contains a space in the center, which is given the name as medullary cavity. This particular medullary cavity is the area which contains our bone marrow. So now my question comes to you. This medullary cavity is present in which part of the bone? It is present in the diaphysis. Do you see this medullary cavity here in the ends? No. This is a classical feature of only diaphysis where you will find this medullary cavity containing something called as bone marrow. Got the idea? Fine. Okay. Now, I have been taking a lot of terminologies about diaphysis and diaphysis. Let me take you the inside story of diaphysis. Okay, fine. Now I showed you this diagram. You see this diagram? This diaphysis has got multiple layers. The outermost layer of this diaphysis, you see this green color thing? This is called as the periosteum. Osteum means bone, peri means above. So the diaphysis is covered on the outside by a covering, which is nothing but a covering which is forming a protection to that diaphysis. That is called as periosteum. Now, if you see clearly, this periosteum or green in color is only till the diaphysis end, not towards the periphery. It is not covering here. It is only on to the diaphysis, right? So this is an important point. What exactly is the outer covering? It is called as periosteum. Now, this periosteum is again divided into two layers. The outermost layer of the periosteum is called as the fibrous layer. See this layer? This is called as a fibrous layer. And the inner side of the periosteum is given the name as cellular layer. So cellular means what? It contains certain bone forming cells. That is why it is called as cellular layer. Okay, now very important part. All our blood supply, all our nerve supply, our lymphatic channels, they all are very rich in this periosteal layer. Remember this. That is why you experience so much of pain as soon as you get a fracture. When you get a hairline fracture, somebody has hit somebody. Why do you get that pain? Because the periosteum is rich in blood vessels as well as nerve fibers, which are running closely inside this. And the periosteum has got two layers. I already told you. Outer fibrous layer, which is nothing made up of fibrous means made up of what? Fibroblast, right? So fibroblast is a cell which makes fibrous layer. So this layer is a fibrous layer, which is a protective layer, and the inside layer is the cellular layer. And I already told you the cellular layer contains bone forming cells. Now, suppose if there is a fracture to a person, right? His periosteum has gotten injured. What will happen? The second thing that will happen will be that as soon as the fracture has happened, these cells that are underneath it will start multiplying and they will start bridging that gap of the fracture, because these are bone forming cells, and it will get that sense that now we have a fracture, we have to bridge that gap. So these cells will start multiplying. Now you're understanding? I'm going to tell about the cells separately, but this is about the general how it works. Right. Now, this is the outer part, the periosteum. The inside of the bone. Now, I told you this is the outer part, which is lined by periosteum. Now, inside there is something called as a medullary cavity. That also I told you. This medullary cavity is also lined by specialized cells. And these are called as endosteum. You understanding? Periosteum means outside. Endosteum means inside. The inner covering of the bone is called as endosteum. And endosteum, you see these cells? You see these cells that are lining? These cells are called as endosteal layer of cells. This is the inner lining of the bone, right? So there are two layers of a bone. Outside there is periosteum, which is again having two layers, outer fibrous, inner cellular, and then comes inner layer of the bone that is called as endosteum. And this endosteum also has got bone forming cells. So if you see the bone forming cell, it is given the name as osteoblast. I'm going to tell you later on, but just remember osteoblast are bone forming cells which are formed or which are found in this endosteal layer as well. Got the idea? Fine. Okay. Now comes another very important MCQ. How does the periosteum attach itself to the bone? So there are specialized fibers which attach this periosteum to the underlying bone. So this is the underlying bone. The periosteum is attached to this underlying bone by certain fibers, and these are given the name as Sharpey's fibers. Sharpey's fibers are the fibers which connect the periosteum to the inside or to the main bone or the shaft. Now you got the idea. So if you see, this is the shaft. This is a compact bone. I already told you the periosteum is getting attached by these fibers or the Sharpey's fibers. So now everything I've covered about what exactly you mean by diaphysis, right? This is what I told you. So we have covered layer by layer from outside the periosteum, which is having two layers, fibrous, cellular. Then I told you about the endosteum, which is nothing but a layer of bone forming cells or osteoblast. And the innermost part is basically nothing but the medullary cavity, which contains bone marrow. So I've already told you what are the layers of this shaft and what is diaphysis, right? Fine. Now we move on to the second part of the bone, that is on the ends. You must have seen there is a head of some bone, the lower end of some bone. This is called as epiphysis. Now again, epi means upon and physis means growth. So epiphysis are the ends of the bone, right? So one end is here, one end is here. And I told you two important features of the epiphysis. Epiphysis is not formed of a compact bone like the diaphysis. This is formed by spongy bone, or let me say a cancellous bone to be precise, right? And this particular epiphysis basically is the one which helps our bone grow. So these are the growth zones of the bone. The bone is not growing from the diaphysis. It is just strengthening you. But the growth of all the bones is happening from these ends, the epiphyseal ends, right? Okay, now let me show you how exactly an epiphysis looks like. So this is what an epiphysis is. Two ends of the bone. I've already spoken to you about this, right? Now, if you closely see about the epiphysis, there are two ends to each bone. One end is called as the head end, or we also call it the proximal end. And the other end is the tail end or the distal end. So whenever we are talking about epiphysis, we can call them generally as proximal epiphysis and distal epiphysis, as simple terms. Correct? Fine. Now, if you clearly see, I told you that in the previous diagram that the whole shaft here or the diaphysis is covered by a lining called as periosteum. But this periosteum is not present over the epiphysis. Why? Because the epiphysis is covered by hyaline cartilage. So see, there is a blue colored cartilage here and there is a blue colored cartilage here. Why exactly that hyaline cartilage has been given to you? My question is now second. This cartilage has been given to you because these are the ends of the bones which form joints. A bone and a bone cannot come together. It has to have a disc in between. And this disc is provided by this articular cartilage. That is why in simple terms, epiphyses do not have a periosteum. They have a very specialized hyaline cartilage over them, and that is called as an articular cartilage. Articulation means joints. And that is why this hyaline cartilage has been given to you. Now you understood? Okay. So it is not having a periosteum. It is having this hyaline cartilage. Now I already told you that if you see this bone, the diaphysis, and if you see this bone, they all seem to be different. Diaphysis is formed of compact bone. I already told you this is a compact bone, which is ivory hard. But if you see the bone of epiphysis, this has something spongy. This is called as a cancellous bone. right? So cancellous means what? Spongy, foam-like. Because of the fact, why it is a sponge-like? Because it has got multiple trabeculae. Now, this is what the term in a bone is. When you say the bone has many gaps, those gaps are called as trabeculations or trabeculae, right? So now I told you what is the difference. Compact bone, here is cancellous bone, correct? This is covered by articular cartilage. Diaphysis is covered by periosteum, then endosteum, correct? If suppose I talk to you about the medullary cavity is present in the diaphysis or the shaft, but there is no medullary cavity that is present in the epiphysis. So see the differences. You can just see this diagram and tell the differences. Another important point, the marrow that is present inside the medullary cavity of shaft is yellow in color. And the marrow that is present inside this epiphysis is red in color. That is why we call it yellow bone marrow is present in diaphysis and red bone marrow is present in epiphysis. Simple as that. Now, what is the meaning of yellow? Why it is yellow? It is because yellow bone marrow is made up of fat and red bone marrow is made up of cells. So red bone marrow is the one which is helping you in creating red blood cells or white blood cells. They are all getting created from the red bone part. So wherever you will have this red bone or cancellous or epiphysis bone, you will have marrow creating cells inside, or the red bone marrow is present inside. But yellow bone marrow is present in the shaft. Another important point. And here only I'll give you a clinical scenario. Suppose I tell you to do a bone marrow biopsy. If you don't know that where is the red bone marrow, then how will you do a bone marrow biopsy? If you puncture this particular diaphysis of your femur or humerus, will you find any red bone marrow inside it? You'll just find fat. This is the clinical aspect to it. Right? Fine. So now you have understood about the epiphysis, you have understood about what the diaphysis is, and you understood that the primary centers of ossification from where the bone is starting to form is in the diaphysis, and the secondary centers which form after birth, they are at the epiphysis. Okay, fine. Now, in between the epiphysis and the end of the diaphysis, you have a small part which is given the name as an epiphyseal plate. Now, what exactly is this epiphyseal plate? These are all questions, okay? So that is why my whole idea is to describe you well what are these so that you don't get confused later on. This epiphyseal plate is nothing but it is a cartilage. Now, I told you the epiphysis has got cartilage. This cartilage is given the name as articular cartilage because this is the part of the epiphysis which is forming joints. And this is hyaline. Now, this epiphysis also has another kind of a cartilaginous plate that is present between the junction of the diaphysis and the epiphysis. And this particular junction or this plate is called as epiphyseal plate. This is also containing hyaline cartilage. Now, why exactly this epiphyseal plate is given to you? Fine. Now, let me explain. Once your, let's suppose a newborn is born. And as soon as the newborn baby is born, his diaphysis is already formed before because of the ossification center. But epiphyses are still not formed. Now, if you just see yourself, when you were at 1 year of age, and now you are sitting now, your height has increased, correct? You per year, your parents or your grandparents must be marking over on the walls, right? And this is your height, or this is your height. You have increased so much. Why? How do these long bones elongate, or how you become that much bigger? It's because of this epiphyseal plate. This epiphyseal plate has got important 3 zones. You see this? So what is the importance of these zones? So if you see this carefully, this epiphyseal plate is containing a lot of cartilage cells. This is called as chondrocyte. Okay, a cartilage cell is called as chondrocyte. Now, whenever there is any kind of a stimulus to us by our hormones, like growth hormones, whenever we are starting to grow later on in life, post-puberty, okay, whenever we attain puberty, we suddenly have a growth spurt. These cells which are in the reserve part or the chondrocytes, they become active and they start proliferating. So see, they start proliferating, many now. And then finally they start maturing. And that is the reason, because of the proliferation and the maturing of these chondrocytes, the long bones will start increasing in length from both the sides. There is an epiphyseal plate at this end, distal end, and there is an epiphyseal end at the proximal end. Now, both of these will start elongating the bone. And that is why you will get that height, what you achieve, because of the elongation. Now, at a particular point of time, the elongation will stop. Otherwise, we'll keep growing, right? So they will stop at one point of time. So let's suppose there is a point at 22 years of age, this epiphysis has stopped to grow, or the epiphyseal plate has stopped to grow. So then what will happen? This hyaline cartilage will ossify. As soon as it will stop growing, it will start ossifying, and it will form a very hard ivory-like bone on both the sides. Now you're understanding what is the meaning of the epiphyseal plate. Epiphyseal plate is made up of hyaline cartilage, right? And this hyaline cartilage is the one which is containing chondrocytes. These are the ones which are basically having reserve cells. Once we get a stimulus of our growth hormones, they start multiplying and they start maturing, and both the ends of the bone start growing because of the epiphyseal plate. That's why I called it the growing end of the bone. Now you're understanding? So when I call the growing end of the bone, what is the end of the bone that is growing? It is about this epiphyseal plate. So either the bone is growing proximally or the bone is growing distally, not on both the sides. Don't think that it is growing both the sides. Either it goes proximally or it grows distally. So there might be a chance that this end of the bone has already ossified now because the work is done, but this bone is still growing because it still has to reach that height. So this will become the growing end of the bone. If this end is growing and this has ossified, then I would call this end as the growing end of the bone. Now you're understanding what do you mean by the term growing end of the bone? It is on the basis of epiphyseal plate, right? Okay. So now you've understood about the epiphysis, the epiphyseal plate, the diaphysis, and what exactly these structures are. Now, just one point to add about another thing that is given the name as metaphysis. Now, what is metaphysis? Don't get confused. Metaphysis is nothing. It is a part of the diaphysis itself towards the epiphyseal end. So the diaphysis, if you see, if this is your diaphysis, you see a part of the diaphysis towards the epiphyseal end is given the name as metaphysis. So this small area that is just beneath the epiphyseal plate is given the name as metaphysis. So we don't call it metaphysis, we call it epiphyseal end of diaphysis. Simple as that. Okay, so just remember this is just a terminology, but the whole thing remains the same. It is diaphysis only, but it is the epiphyseal end of the diaphysis, which is joining the diaphysis to the epiphyseal plate, and this junction is called as metaphysis. Now you understood what is metaphysis, what is diaphysis, and what is epiphysis, and what is the epiphyseal plate, right? So I already told you each and everything, what is the difference between them. Okay, I'll come back to you when I revise this. Don't worry. Okay, I'm going to revise this later on. Now, again, if you see here, simple as that, proximal most, this is the proximal epiphysis. This is distal epiphysis. This is made up of spongy or cancellous bone. Here also it is spongy or cancellous bone. Then there is a junction called as metaphysis. And then there is something called as diaphysis or the shaft, which is containing a medullary cavity. Simple as that. Now you understood, right? Okay, fine. So here itself, the same thing, what exactly I told you. So this is the epiphysis. This is covered by articular cartilage. Then there is a epiphyseal end, which is proximal. This is called as the proximal epiphysis, and it is containing spongy bone. This is again the spongy bone or lower end of epiphysis. They contain the red bone marrow. That also I told you. And in the center, this is containing the yellow bone marrow, and this is the diaphysis. The diaphysis has got layers. The outermost layer is the periosteum, which is again having two layers, outer fibrous, inner cellular. And then after that, the innermost layer of that is called as the endosteum. And finally, there is a cavity in the center, which is filled with yellow bone marrow. And this is called as medullary cavity. Simple. This is the crux of what I told you about the structure of a long bone. Right. So many of the times your examiners are keen to ask that what do you understand by a compact bone? What do you understand by a cancellous bone? This is the whole crux. This chart is the whole crux of it, whatever I have told you. So you know that the compact bone is found in the diaphysis or the shaft, and the cancellous is found in the epiphysis, that is on the ends of the bone. And if you see the compact bone, they are having arranged Harvesian systems. Now, don't worry about this part. I'm going to cover each and every detail about histology in a separate segment. So bones are made up of Harvesian canals or systems. This is well formed in a compact bone. That is why it is dense. And here it is not well formed. That is why it is in the form of a mesh, what we call as trabeculae. Okay, that is why it is spongy. Now, the bone marrow in the diaphysis is yellow, right? And the bone marrow in the cancellous bone is red. But the catch point, what has been asked you in your MCQs, that before puberty, what exactly is the bone marrow found in your diaphysis? So red bone marrow is present in all our bones in every particular place before puberty. Remember that point. Later on in the diaphysis, that red changes to yellow, which is fat. But before puberty, we require a lot of cells for growth. And that is the reason red bone marrow is present before puberty in all our long bones. After that, it is only present in the cancellous part or in the epiphyseal part, right? Then I already told you that that the compact bones are very hard and ivory-like around the shaft, and the spongy bones or the cancellous bones are very spongy and they are not very hard. That is why these are the bones which are likely to get fractured very easily. But the diaphysis won't get fractured so easily because it is ivory hard. It is having a very well-formed RVCN system. And that is why it is giving a compact appearance. Got the idea, right? So these are the two differences. These are the differences between compact bone and cancellous bone. Or you can even say, if you're asked a question, what is the difference between diaphysis and epiphysis? And you have to write all of these things, right? Understood? Fine. So this makes things more clearer to us. Now I come to what exactly is the supply of bones. And here I'm going to give you critical things which are very important to understand. Don't mug up this part. Okay, whatever bones are, understand them well. So any particular thing in our body requires blood to survive, right? And even a bone has to have blood in order to survive. That is why bones have a very rich blood supply of their own. Now, what is the blood supply? The main supply of any bone happens through a parent artery. And this artery is called as the nutrient artery. Why it has been called nutrient artery? Because it carries nutrients inside the bone. This nutrient artery enters inside the bone by a canal, or a foramen, which is called as nutrient foramen. So let's suppose my cursor is here. This dot is the nutrient foramen of this particular bone. So no matter what bone is given to you in long bones, I'm talking about long bones. If suppose a femur is given to you, if suppose a tibia is given to you, you will always find a small tiny aperture in those shaft. That aperture is nothing but a nutrient foramen. And this nutrient foramen, what does it do? It carries all the nutrient artery through it. Now, as soon as the nutrient artery enters inside the bone, you know what is inside? This is the medullary cavity, correct? So there is space. This is the cavity. This particular nutrient artery divides into an ascending part, and then it divides into a descending part. And then once it goes to the end of the metaphysis, see, this is the metaphysis. This is the epiphyseal growth plate again. This is the epiphysis. So as soon as it goes towards the end of the metaphysis, these arteries become bent because they are end arteries. They end here. That is why they become bent. This bend is given the name as hairpin bend. Very, very important. Okay, remember this. Just remember this line. This is called as a hairpin. This looks like a hairpin. These are hairpin bends that have been by the nutrient artery on either sides. Okay. Next point. These particular any bone has also got certain other arteries which are supplying it. So the epiphysis is supplied by epiphyseal artery. Metaphysis is supplied by metaphyseal artery. Periosteum of the bone is supplied by periosteal artery. So you need to know 4 names: epiphyseal artery, metaphyseal artery, periosteal artery, and nutrient artery. Nutrient artery is the one which has got ascending part, descending part, and it forms something called as end arteries or hairpin bends. Okay, fine. Now, important part. The periosteum is basic, or the periosteal artery, let's say, it supplies the outer 1/3 of the compact bone. So if this is a compact bone, the outer 1/3 only is given by periosteal arteries. But all the other 2/3 of the compact bone, the medullary cavity inside, everything is being supplied by nutrient arteries. This is also a question to you. What exactly is supplied by the nutrient artery? So inner 2/3 of the compact bone, as well as the medullary cavity, is all supplied by nutrient artery. And it forms something called as hairpin bends, which are nothing but like hook-like end arteries on either sides. Now, if you see this hairpin bend, it looks like this. See on each side, right? What is the problem here? When a child is getting its nutrition in the earlier part of his growing years through these hairpin bends, if suppose he falls down from a bike, let's suppose there is a boy, he falls down from a bike, he's just riding his cycle and he's 6 years old. And he gets an injury over his humerus, right? Over his arm. There is a small fracture there over this area. Now, bacteria will start entering through this line. And what will happen? They will enter these arteries. Now, because these arteries are they are end arteries. They can't go anywhere else. These bacteria will go and they will start multiplying in this bend. That is why this is called as a hairpin bend. And because they will start multiplying in this hairpin bend, Because of this scenario, children have more chances of getting a disease called as osteomyelitis. What do you mean by that? Osteomyelitis is nothing, but it is an inflammation of the bones, right? And that is because children are more predisposed to it, because in this particular area, at this particular area in the metaphyseal epiphyseal junction, they have got these hairpin bends, and these hairpin bends capture or trap these organisms or bacteria, and they cannot flow out. So they get trapped in these bends, and that is the reason they lead more to osteomyelitis. So that is my question. Why does osteomyelitis occur more in children? Why? Because of these hairpin bends, which are present because of the nutrient artery on either sides of the long bone. Fine? Got the idea? Okay. So now you understood about what exactly is this importance of this blood vessel, or what exactly is the nutrient artery doing. Okay. Now, how exactly the nutrient artery is entering inside? It is entering through a foramen. And I told you this foramen is present in every bone, even here, even here, even here. In every long bone, this foramen is present. And that is given the name as nutrient foramen because it is a nutrient artery. Now, the question to you is, where exactly will you find this nutrient foramen? So nutrient foramen, you have a very, very important question, as well as there is a mnemonic that goes with it. To the elbow I go, from the knee I flee. So remember this mnemonic. Why is it important? If suppose I'm talking to you about the elbow. So to the elbow I go. Nutrient foramen is always oblique. It is not straight like this. It is always oblique. Now the obliquity of this nutrient foramen is always away from the growing end of the bone. Now you understood what exactly it means. I told you about something called as growing end, which is the epiphyseal ends which grow. Now this particular foramen or the nutrient foramen is oblique. It is always going to be, its obliquity will be away from the growing ends of the bone. So how you can remember it is by simple mnemonic, to the elbow I go. That means if suppose there is a nutrient foramen which is present here, it will always be directed this way. This foramen here will be always be directed towards the elbow. So towards the elbow I go. That means the growing end of the bone will be opposite to the nutrient foramen. That means if suppose this is the nutrient foramen going towards this side, the growing ends of these bones will be here and here. I told you growing end of the bone is opposite to the obliquity of nutrient foramen. Remember this line. Okay. So suppose if I'm talking about this, so the nutrient foramen will be directed towards the elbow, down like this. Here, radius and ulna, it will be directed upwards towards the elbow. So the growing end of the bone will be opposite. It will be distal here and here. Understood. But in the case, when you understand about the leg as well as the thigh, what exactly happens there? In that particular area, it is from the knee I flee. That means here the scenario is different. So it is flowing away from that particular knee joint. So see, here it is coming, here it is flowing away. So now if I ask you, if it is going this way, if the nutrient foramen is going this way or oblique this way, where will be the growing end of the bone? It will be proximal to it. So here will be the growing end of the bones. Correct? So just by looking at the nutrient foramen obliquity, your examiner will ask you, what is the growing end of this particular bone? You will tell that this is the area where it will grow. You understood this concept, right? Don't forget this line. This is very, very critical and important when your vivas are concerned. Okay, they will ask you this, right? Okay, so I told you, see, this is a nutrient foramen of this particular long bone, right? And I already told you that what exactly will be the mnemonic? They are growing towards the elbow. They are going away from the knee or from the lower limb, right? So the growing end of the bone will be what? This will be the question, correct? So this is what tiny apertures of these nutrient foramen will look like, through which that nutrient artery will come. Okay, they can be one also, they can be two also. That doesn't matter. But the nutrient artery will come through these oblique channels called nutrient foramen. Remember this. Okay, fine. So now I already told you what exactly all of this means and what exactly these terminologies carry, or what exactly is the importance of these bone things, what you have seen. Now I'll come to you with the concept of ossification centers. Now this is something which has been troubling a lot, that people get a lot confused. This bone has got 14 ossification centers. This bone has got 12 ossification centers. You start mugging it up. That's got nothing to do with mugging up. You have to understand the concept here. Why these ossification centers have been given to you. Okay. So I already told you that the primary centers or primary ossification centers are the centers which form before birth. And secondary ossification centers are the centers which form after birth. So primary ossification centers are found at the diaphysis. Secondary ossification centers are found in the epiphysis. This we have already told. Now there is something called as a law of ossification. The law of ossification states that the secondary centers which appear first are the last to unite. Now this is something that you need to remember. So that means whatever center, suppose this center in the epiphysis appeared first, so this will be the last to unite. Suppose this center came first, so this will be the last to unite. This is called as law of ossification. And I already told you that these are the epiphyseal plates which are having this cartilage, and this cartilage, whenever the growth is achieved, and the growth is maximum achieved by 25 years of age. There is no bone which grows beyond 25. So mostly all our bones grow till 25, and once they form, once we reach 25, all of these epiphyseal plates will get ossified finally. And that ossification will be over the hyaline cartilage that I already told you. What is the role of that hyaline cartilage also? Correct? Fine. Okay. So now I have a clinical scenario to you. Suppose this is an X-ray I have taken, and this is a newborn child. So don't think that this boy or this girl doesn't have any bones, or this is a clinical, this is something that we get confused. That if you take a newborn X-ray, we see that, oh, this is something, so many gaps are there, this child has a fracture, there's nothing. This is a normal X-ray. Why? Because you know that now the only diaphysis will be formed. That is the primary center. So if a newborn X-ray is taken, they will only have this bone which is formed. So you will only see that. Only see this, because the diaphyses are the only things that are formed. But the epiphyseal ends are yet to start growing. And that is what is I told you, that they will cause the elongation of bone through that epiphyseal plate once they form. That is why, let's suppose I take an X-ray of a 25-year-old adult. Here I can see the epiphysis on both the sides, as well as a very well-formed diaphysis. Now you understood what is the meaning of these kind of scenarios. Okay, so the diaphysis of the shaft is primary, and the epiphysis or the secondary centers are later in life, and that usually ossify till 25 years of age. Okay, this is what the laws of ossifications are. Fine. Now we move on to the concept of bone cells. Okay, so this is a huge chapter, and that is why I've tried to make it into a crux and present it to you. But if you start reading it one by one, you'll get confused. Okay, first, clear off your concepts. So now I have told you about ossification centers. Now I'll tell you how this bone will ossify. Why this bone will ossify, or how come this bone is ossifying so early from childhood to adult life. So if you see, our whole bone is made up of these important 4 cells. Okay. There are certain cells which are stem cells. That means they are our parent cells. They are just lying there, the stem cells. These are called as osteogenic cells, also given the name as mesenchymal cells. So these are our grandparents. Wherever things will go wrong, these mesenchymal cells will start growing and they will start forming new cells. Okay, these are the grandparent cells or the osteogenic cells. Now there are some cells which form the bone. Okay, or we call them builders. So builders and blast. Remember this way. So when I say osteoblast, they are bone forming cells. They are the builders. There are certain things which are not only letting that bone form, but there are also cells which are diluting that bone or which are cutting that bone. Now, why cutting is important? I cannot let my bone grow in width and in length for whole life. There has to be a balance between making and cutting. When a building is getting formed, there are certain things which you need to cut down, extra things, right? So what do that function, or how is that function carried out? They are carried out by very important cutters, and they are called as clast. So osteoclast are cutters which remodel the bone or shape the bone, and blast are again builders. They form the bone. Okay. Now, what exactly is an osteocyte? Osteocyte is nothing. It is a bone forming cell. So if we say that osteoblast is the one which is forming bone, it is a type of an osteocyte. Or if we say an osteoclast is cutting bone, it is a type of an osteocyte. These are basically nothing but bone cells. We give it the name as osteocytes, right? Okay. Now let me take to you how this ossification happens. Again, very important. When you read up your BDC, you'll get all confused in this particular area. What is intramembranous ossification? what is endochondral ossification. So this has a very clear-cut concept and very easy to understand if you have understood the story till now. Okay, fine. So I have told you that you have got ossification centers which are primary and secondary, and these ossification centers are ossifying. Now, ossification takes place by two important methods. Intramembranous, that means either it is a membrane and it gets ossified, or it is a cartilage which gets ossified. So before birth, the template is either a membrane or a cartilage, which later on ossifies and forms bone. If it is membrane, then we call it intramembranous. If it is cartilage, we call it endochondral. Now you need to understand what is happening here. Now first, let me tell you about intramembranous ossification. Intramembranous ossification is the ossification which is found in all our flat bones. It is found in all our flat bones. Flat bones means what? This is flat, this is flat. So I have a mnemonic, anything above the clavicle. Anything above the clavicle is flat. Everything that is above the clavicle undergoes intramembranous ossification. Just as simple as that. Flat bones, facial bones, skull bones, they're all flat bones, right? What exactly happens in intramembranous? So as soon as the membrane is being laid down, I already told you, as soon as there is any impulse or any kind of a growth hormone that is released in our body, which wants our bones to grow, what will happen? There are certain cells I already told you, which are given the name as grandparent cells, and these are mesenchymal cells. They are just like that. I told you it's a connective tissue. This connective tissue has got a lot of grandparent cells. These will get stimulated by our hormones, which are wanting growth to happen. Once this mesenchymal cells get stimulated, they will convert into bone forming cells. And I already told you what is the bone forming cells? The builders, the blast. That is called as osteoblast. Now see, these osteoblasts are formed. These are the bone forming cells. Once these osteoblasts are formed, they will start releasing some substance or a matrix outside. They will start releasing something. Now this matrix or substance that they will start releasing outside, this is blue in color, and this is given the name as nothing, but it is called as an osteoid. Okay, this is called as an osteoid that the bone is forming. Okay, now this blast will keep forming the osteoid, it will keep forming the osteoid, but after one particular point of time, these blasts will stop functioning and they will finally be trapped inside this osteoid matrix. So see, now they have stopped functioning and they have been trapped inside this osteoid matrix. Now these cells are called as osteocytes. I already told you that once the function is finished, they will just lie there and they will be called as osteocytes or bone cells, because now their function is finished. So you have got an osteoid and you have got these bone cells which are called as osteocytes, which are present inside this matrix. Now what will happen? Once these osteocytes are present inside this osteoid matrix, now there will be accumulation of some cells also which are cutters. Now what are those cutters? Those cutters are osteoclasts. So they will start cutting off the major osteoid that has been formed here and there, here and there. So see, the cutting has taken place and now here and there, some or the other lacunae or trabeculae have formed. Right? Now why have they been created, these lacunae? To fill up your bone marrow. Now you understood. So these lacunae by the cutters will be created in order to form your bone marrow, so that you have space, so that your bone marrow can accumulate. And finally, blood vessels will start growing inside this bone and it will become vascularized and the bone is ready to grow. So this is how intramembranous ossification takes place. Just a revision. First, there are mesenchymal cells. Mesenchymal cells are parent cells. They will form something called as osteoblast. Osteoblast are bone forming cells. They will release something called as a matrix. Matrix is called as an osteoid. Once they will form this matrix, they will stop functioning and they will become into osteocytes. These osteocytes will get trapped in this osteoid matrix and these osteoblasts will start covering the bone from the outside. Now the osteoclast will come in and they will start cutting this bone into multiple lacunae so that our bone marrow can start forming. And once it forms these lacunae, blood vessels start growing inside and they will finally vascularize the bone. Simple. This is called as intramembranous ossification. Got the idea? Fine. Okay. Now we move on to endochondral ossification. How does a cartilage form a bone? Okay. So these are just multiple paragraphs in your BDCs, but you need to understand this before going into and reading. Okay. That's why my whole motive is to make you understand the bone through and through. Now, what exactly is a cartilage? I already told you, when a baby is born, right, they already have something called as a template, and over that template, a bone is getting formed. Now, either that template can be a membrane or that template can be a cartilage. Now, in some bones, you have this cartilage. Which bones you have? Endochondral ossification, my mnemonic same, anything below the level of the clavicle. So all your rib cage, all your upper limb, lower limb, any bone, whatever you are taking below the level of the clavicle are all getting ossified by endochondral ossification. Above the level of clavicle, flat bones, again, intramembranous ossification. Now, how does that endochondral ossification happen? In the beginning, you have a template. This is a cartilage, and this is called as a cartilage template. It is just lying there. Okay, see, this is a hyaline cartilage template. Now, what will happen? Under the influence of growth hormones, as soon as the baby will get a stimulus that I have to start growing, the mesenchymal cells or the grandparent cells which are present inside here will get again stimulated, just like the last time. And once they start stimulating, they will start producing which cell? Osteoblast. Same story. Those osteoblasts will go and accumulate in this particular area of the bone. And this is the diaphysis end. And this area will be called now as bone collar. So I told you, primary ossification center is where? It's in the diaphysis. Now you understand how did that diaphysis ossification center came? It's because once the influence happened, because of these because of the influence of our growth hormones, mesenchymal cells started proliferating from here, and they started forming a kind of a sheath of cells on the diaphysis. And this is called as a bone collar. And this bone collar is nothing, it is our primary ossification center, where our bone will start ossifying, right? Okay. Now, once our primary ossification center is formed, now we want more bone and we want less of cartilage. So now what will happen? The center part of the cartilage will start deteriorating. That means it will start vanishing. And once it will start vanishing, it will form into a cavity. Now I told you long bones have got medullary cavity. How did that medullary cavity came into being? It is because of the cartilage which has deteriorated from the matrix. Got the idea? And that is how you see this cavity getting formed. Now, once this cavity is formed, because of the deterioration or because of the vanishing of the cartilage from the center, blood vessel will come inside and start sprouting in. Now, the area where the blood vessel will come in, it will come through what? It will come through the periosteum. This area is called as periosteal bud. Periosteal bud. From where this particular artery will come inside the medullary cavity and will start giving its nutrition. Got the idea? What is that artery? Nutrient artery. So it will come inside, it will start proliferating, and it will start growing on both the ends. Now, once that nutrient artery is formed, the whole canal will start forming, the whole cavity will start forming, the vascularization will start forming, and you will see epiphyseal vessels are also coming on both the ends. So now the bone is getting laid. Now the bone is started to form because it is supplied by the nutrition supplied from the nutrient artery. And this cavity is already formed now. Now, once the cavity is completely formed, what will happen? This bone will undergo complete ossification by these osteoblasts. So now see, there is no cartilage left. But which areas will the cartilage be left behind? I told you, which areas of the bone are lined by cartilage? Epiphyseal plate and articular cartilage of the epiphysis. See this end? This is the end or the articular end of the epiphysis. This retains the cartilage, and this end is again the epiphyseal plate cartilage. This also retains the cartilage. Everything else forms the bone or the hardened part. Now you got it? So this is called as endochondral ossification, or simply calling it ossification happening inside a cartilage. Okay, fine, right. So now we understood the same logic goes here. Mesenchymal cells, osteoid, forming this particular part. This is our intramembranous, and this is what endochondral ossification on a cartilage template. A bone is getting formed. Okay, just to give you an idea. So don't worry, even if you don't understand, you just to have an idea. Okay, now I'll just move on to the last part of what you need to just memorize and more see rather than mugging it up, right? So you have to see more. Now you have understood the long bone. Now see how the classification will become so easy for you. Okay, so again, a hit question. This will be a long essay question for you. Define or make a structure of a long bone and classify bones. So how will you classify them? So classification of bones have been given to you according to various things. The first classification of bone is on the basis of shape and size. This we have already discussed. So the first part of our bone that according to the shape and size is long bone. Now you already know what is a long bone. A long bone is a one which is longer than wider. It has got more length than width. So what are the examples of long bones? You already know: femur, humerus, or ulna, radius, tibia, fibula, all these things which are forming our limbs. All examples of long bones, right? These are according to the shape and size. So that is number one. Okay. The second part is something called as miniature long bones. Now I told you there is the first according to shape and size is long bones. A variant of long bones is called as miniature long bones. That means these are long bones, but they are tiny. Now, what exactly are these bones? Miniature long bones. Miniature long bones are carpal bones and tarsal bones. So if I have on the plantar aspect on my foot, I will have something like this on my foot. The bones here, they are called as metatarsals. Here on my hand or my palm, I have these bones you can even press. These are called as what? These are called as metacarpals. Correct? These are called as phalanges. These are called as metacarpals. So you can see here, these are called as metacarpals. Now, what is the difference between this miniature long bone and a normal long bone? I told you a long bone has got two ends, two epiphyses, and a single shaft in between. But if we take metacarpal or metatarsal, the only difference between why they are miniature is they don't have two epiphyseal ends. They have something called as a head, a body, and a base. So they don't have two epiphyses. They only have one epiphysis. Remember this. This has come multiple times. So one epiphysis is only present at the head. No other thing has an epiphysis here. If you take a long bone like femur, they will have epiphyses on both the ends. But this will have only one epiphysis at one end. So this is called as a head, this is called as a body, this is called as a base. So that's why I told you if you take this bone, it has got two ends. And these two ends are both epiphyses. But here, there's nothing. There's only one epiphysis. That's why they are called as miniature long bones. Okay. Example, metacarpal, metatarsal. Right. Now we come to the third bone. Third bone is again on the basis of the shape and the size. These are cube-like. Now, if you see this is a cube-like. That means the length and the width of these bones are almost equal. They're cuboidal. Okay. So what is the example? Example is again wrist bone. Okay. Or our ankle bones. They are all cube-like. Okay. Just remember wrist. Okay. So see this wrist. There are multiple bones here. No need to remember the names. Okay. Just remember there are multiple bones which are forming the wrist. And these are wrist bones are also given the name as carpal bones. So when we say carpal bones, we are nothing but we are calling these as short bones which are cuboidal. This is an example of short bones. Okay. Now, according to the size and shape, I already told you there are certain things called as flat bones. So if you remember, I discussed about intramembranous ossification. Which bones undergo intramembranous ossification? They are basically flat bones, right? So flat bones are where? They are here over on my skull vault. Okay. They are all over my face. These are all my flat bones, correct? Another flat bone is this particular thing, that is basically the rib, as well as the center, the sternum. Okay. And if you see behind there is this particular structure, this is called as a scapula. This is also flat. So see anything, they are looking flat. Ribs, this particular structure called as a sternum, this particular structure behind is called as a scapula, as well as the skull, as well as the facial bones. They are all flat bones because they are all flat. Okay. Got the idea? Now, another according to the shape and size, they have irregular bones. Now, simply just remember whatever in your body looks irregular. They are all irregular bones. No need to memorize them. See, all our vertebral column, they've all got these external projections here and there. They form it. Everything is irregular there. See, everything is irregular. If you go over on the face, nothing is regular on my face. They're all irregular, right? Everything is irregular here. So all facial bones, irregular. Vertebrae, irregular. Even if you see my pelvic girdle, where there is a very important bone that is called as sacrum, that is also irregular. You see, there are multiple holes here. It makes it very irregular, right? So all our irregular bones are in the center, if you see. Everything is in the center. That means all our facial bones, again, vertebrae and sacrum. They're all in the center. Remember this diagram. They are all irregular bones. Otherwise, it's very difficult to memorize so many bones in our body. Now, another high yield point question. Something called as sesamoid bone, favorite of examiners to ask. Now, sesamoid bones are what? Sesamoid is taken from a word seed-like. So if you see these seeds, they are seed-like. Okay. Name two important sesamoid bones of the body. One important is your patella. Patella is your kneecap. Now, I want every one of you to feel your kneecap, where your kneecap is. Just feel it. You'll find some kind of a triangle there. That is your patella or patella bone. Okay. And one bone, I want every one of you to feel on the other side of your thumb here. You see this bone that is again coming out. This bone is given the name as pisiform bone. Pisiform is pea-like, just like a small pea. This is called as pisiform bone. Here, you can feel it easily. Now the question comes, why exactly the sesamoid bones have been given to you? So sesamoid bones are great anatomical pulleys. That means if suppose any muscle will come from here to here, this will act like a pulley. And I'm going to show you how it will act like a pulley. Because the force of contraction it will prevent. And I'll tell you with a very simple diagram how they are pulleys. Now the classical feature of these are they do not have a medullary cavity. They do not have a periosteum. That is the reason, because they don't have medullary cavity, they do not have periosteum, these bones do not heal well after fractures. So if a person comes to you with a patella fracture and the question is, why is my fracture not healing? 3 years has happened. Because of the fact, now you understand, because you know that there is no periosteum over the patella. There is no medullary cavity in the patella. So how will it get its nutrition? By no way. So that is why the fracture will heal very slowly in these particular bones than in cases of other bones. Understood? Right. So pisiform here and patella here. These are the two bones which have these which are called as sesamoid bones. Now, why exactly I told you is the importance of these bones. They act as anatomical pulleys. I told you that, right? How? Suppose this is your knee joint. This is the lower end of your femur. This is the upper end of your tibia. One muscle is going from the femur and going and attaching itself on the tibia. This is one thing. Now, suppose if this muscle goes like this, and if this joint contracts, or if you bend your joint, the force that will be applied will be in this direction. So this will be simply called as a torque. The torque will be applied straight, and this is a translational force. Correct? What will happen? If this force is applied like this, both the structures will hit together and it cause friction. You won't be able to move. So now what God created? He created a bone in between. That's why it's called a sesamoid. See, a seed-like small bone. So now what happened? Now the muscle has to turn and go. And because of this, it will act as a pulley. So now the translational force is being converted to an angular force. And because of this angular force being directed downwards like this, it will decrease the friction between these two structures. And because of the less of friction, there is less of chances that we enter into pathological problems. Right? But again, I told you, what are the two main features? No medullary cavity, no periosteum. That is why no medullary cavity, that means that it won't have any bone marrow, no hemopoiesis, no blood cell formation. Does not heal well. Why? Because there is no periosteum and there is no medullary cavity, so automatically it will not heal. Simple as that. Got it? Fine. Seventh category of bone according to shape and size is pneumatic bone. Now, what do you mean by pneumo? Means air. Simple. Pneumo means where around my nasal cavity, there are certain bones which are called as pneumatic sinuses, or which are called as paranasal sinus. Paranasal means around my nose. So there are 4 types of sinuses which are present here. And if you remember in the beginning, I told you timbre of voice, right? So that is where paranasal sinuses come. These are filled with air. See, these are all filled with air. This is maxillary sinus because it is in the maxilla bone. This is frontal sinus because it is in the frontal bone. This is ethmoid sinus because it's in the ethmoid bone. This is sphenoid sinus because it is in the sphenoid bone. Even if you don't remember the names, no need to worry. Just remember pneumatic bones are our paranasal sinuses because they contain air. Now, because they contain air, they make our skull lighter and they give a resonance to our voice. Main 2 important functions of pneumatic bones is they make the skull lighter because they are filled with air. And the second thing is that they basically give resonance to our voice. Now, suppose if you have got fluid filled inside them, which we call as sinusitis, what will happen? You start feeling heavy, right? You don't feel light. You start very heavy here, very heavy here. Why? Because the pneumatization is not there. There are no more pneumatic there because fluid is filled inside. Got the idea? So these are the categories of bones according to shape and size. And I told you all the 7 categories of bones. Now, this I've already told you according to ossification, so I don't need to go inside them. There are certain bones which form from intramembranous ossification. And then I told you all the flat bones. Now, you know what are the flat bones, correct? There are certain bones which are formed from endochondral ossification. So I told you a mnemonic, all bones below the skull except the clavicle. Remember this, according to ossification, they'll be all by endochondral ossification. Got the idea? This is according to ossification. You already understood ossification. So there's nothing to go inside this. Now, what they have asked you in your papers, They are very smart. They ask you certain bones which ossify from both sides. That means they are half membranous, half cartilaginous. So how to remember those bones? So there is simple mnemonic to that, Tom's clavicle. How I used to remember it. So what is Tom's clavicle? Temporal, occipital, mandible, sphenoid, and clavicle itself. These are the bones which basically are from both the membrane and the cartilage. That's why we call it membranocartilaginous bones. So this is a very important MCQ for you. What are membranocartilaginous bones? Tom's clavicle, temporal, occipital, mandible, sphenoid, and clavicle itself. Got the idea? Right? So this is about on the basis of ossification. So you know, on the basis of ossification, we have got three types of ossifications that can happen. Either it can be intramembranous, endochondral, or both membranocartilaginous. And you know what all bones are getting ossified there. Okay. Third type of classification of bones are on the basis of region. So this is also very, very easy. Region means what? Something that is in the center or the axis of our body. This is called as center or axial skeleton. And something which is attaching as an appendage. Appendage means what? As an extra thing that attaches to the main thing. This is the main thing. And these are all attaching to the main thing in the center. So this is called as appendicular skeleton. So whatever things like the whole pelvic girdle, the lower limb, the upper limb, the shoulder, they are all parts of what? They are all parts of appendicular skeleton. When it comes to the axis, from your head till your tailbone, everything is your axial skeleton. Now, what have they asked you? This is also, I've written it in red in your MCQs. How many bones are there inside the body? So you already know there are 206 bones inside the body. And how many of them are axial bones? So the center ones are axial are 80 and the side ones are 126. This is an asked question. That is why I have mentioned. Otherwise, there is nothing important in all of this to remember how many are there. But they have asked you, so you should remember them. Okay. Now comes structural classification. I've already told you that according to the structure, the bone can have cancellous bone or compact bone. Compact, you know what is a compact bone, you know what is a cancellous bone, so I won't go into it, right? So you know these are the two types of bones on the basis of structure. Now, just to end this, there is something called as a Wolff's trajectory theory, which is being given in your BD Chaurasia as well. That's why I'm covering here. If you see this particular epiphyseal end, okay, I told you this is made up of what bone? Cancellous bone, or it is made up of spongy bone. So why exactly or how exactly this sponginess comes into it? This comes into it by something called as compression lamellae. So lamella are nothing. They are nothing, but these are like the trabeculae are aligned in such a way so that they can compress and take the tension accordingly. So all our weight-bearing joints are the hip joints, right? As well as the knee joint. These are the maximum weight-bearing joint. So in the epiphyses of this weight-bearing joint, there are certain trabeculations or lamellae which are present. Now this lamellae are called as tension lamellae and compression lamellae. So there was someone called as Wolff and he called as a trajectory theory. Now what exactly is this trajectory theory? He said whenever we are standing, so our maximum tension and compression forces of any bone are over the epiphyseal end. So because of this epiphysis, our body can basically take up the weight in the form of compression by this compression lamellae and all the tension through this tension lamellae. So just remember there are two lamellae or two trabeculations or form of bands that go and they prevent us from compression injury as well as from tension injury. Otherwise, we won't be able to work properly. This is called as Wolff's trajectory theory. So they are like trajectiles of these two types of lamellae, which are present in our epiphysis, not anywhere else, only in the epiphysis, right? Okay. Final part is what are the types of epiphysis? Now, this is also, again, a question to you that is asked you in essays. Essay question. Okay, this is also, again, that's why this chapter I've highlighted everything as 3-star or 4-star, because they come like this as questions to you in your papers. What are the types of epiphysis? So now you know what is epiphysis, the growing ends of the bone. You know what is epiphyseal plate. You know what is cancellous bone. You know about what is Wolff trajectory theory. You know about everything else. According to the pressure or the tension they take, these epiphyses have been classified into 4 varieties. Okay. Now I'll tell you a very simple way of remembering this. And I'll show you a diagram and you'll remember everything through that one diagram. First thing is called as pressure epiphysis. Now, I already told you, all are weight-bearing joints. Suppose a hip joint, right? Suppose a knee joint. These are weight-bearing joints. The head of the humerus, shoulder, femur, condyles of a tibia, right? That is in the leg. They are all examples where pressure is maximum. So their epiphysis is taking up all the pressure. And how is that pressure being taken up? By tension lamellae and compression lamellae that Wolf told you, right? So these are called as pressure epiphysis. So pressure epiphysis means all the articular areas of the bone. Now, I told you articular areas are nothing but the joint forming areas, which have this kind of hyaline cartilage with them. So if it says the knee joint, which is by the tibia, right? If it says the hip joint by the femur, if it says the shoulder joint by the humerus, they are all articular bones. They are forming joints. They take up the maximum pressure. So where will you find pressure epiphysis? All in weight-bearing areas, or all in those areas which are forming joints or are articular. Articular means they are forming joints. So examples would be head of humerus, head of femur, condyles of tibia. Simple, because they are all weight-bearing. Correct? These are called as pressure epiphysis. So see this is how the weight will come, and that's why it's called as pressure epiphysis. The second will be traction epiphysis. Now the same diagram you see behind, there are two things where muscles are attaching. So they are non-articular. So simple words, traction epiphysis is seen in areas of the bone where there is non-articular part. That means the epiphysis, this part is the area which is articulating. But the part of the epiphysis which is not articulating is this part which is under traction. And what is giving it traction? The muscles which are attaching to it, or the muscular pull which is attaching to it. Now you must be thinking, okay, that how did this bone become such big, like humps? It is because of the traction produced by these pulls. If suppose any muscle is attaching here, once it will contract, it will start or pull this particular part of the bone. That is why it will become like a hump. Here also it will become like a hump. This is called as traction epiphysis. So again, a question, pressure epiphysis is the articular part. Traction epiphysis is non-articular part. Pressure epiphysis is in the weight-bearing area. Traction epiphysis is in the area which developed because of the pull of the muscle or the ligament. Simple. So either it can be tubercles or they can be trochanters. So now if somehow your any upper limb class has been taken or lower limb class has been taken, then you must be knowing that there are certain things called as tubercles and trochanters. So tubercles are in the humerus and trochanters are there in the femur. So you see this elevation, this is called as greater trochanter. This is called as lesser trochanter. This is called as greater tubercle. This is called as lesser tubercle. So basically this is humerus, this is the femur. And all of these are examples of what? They are examples of traction epiphysis, because muscles get attached here and they hump them. They take them out. Correct? And what is this part? This is the head. What is this part of epiphysis called as? This is the pressure epiphysis. This is the pressure epiphysis. So just by one diagram, you understood that trochanters and tubercles which are present here are traction epiphysis. And this is your pressure epiphysis, which is over the head, which is forming joints. Now comes the third variety of epiphysis, the second last variety of epiphysis. This is called as atavistic epiphysis. Favorite question in your MCQs to confuse you. What is atavism? Atavism means that something which is very well developed in other animals, but not very well developed in humans. That is called as atavism or atavistic. Okay, so that means if there is a remnant of individual bones well developed in animals, that means we just have some kind of a remnant. How to remember this thing? This thing can be remembered by some bone looks like a crow. Okay, have you seen a crow? Crow has a beak. Okay, that crow beak is literally present in even one of our bones. See this? You see this crow beak kind of a thing? This is called as coracoid process. That's why it's been given that name. Coracoid means a crow beak. See this? This is called as a coracoid process. So now in this shoulder diagram only you can understand all your epiphyses here. What I told you. Coracoid process is here. It is an example of atavistic epiphysis. That means it has got no role, no function, very well developed in animals, but it is just present as a small projection in humans. That is atavistic. Similarly, this is pressure forming joint. This is pressure epiphysis. This is where muscles attach. This is traction epiphysis, which is nothing but the tubercles. Got the idea? So I told you simple ways. Just by one diagram, you can understand the whole of epiphysis. Otherwise, you'll keep mugging it up. It will all wash away in one day. You have to create these concepts, right? And finally, we reach the last part of epiphysis and bone, that is aberrant epiphysis. Now, what do you mean by aberrant epiphysis? Now, I've already created some kind of a logic inside you of what exactly is short bones or what is miniature long bone. So if you remember what I told in miniature long bone, I told you long bones have got two ends called as epiphysis. But when it comes to miniature long bones, there is nothing called as two ends. There is something called as a head, a body, and there is a base. So if you see, this is your, again, metacarpals, which I told you here. This is a head, this is a body, and this is a base of this particular metacarpal. This is the thumb. This is first, second, third, fourth. So this is my first metacarpal, second, third, fourth, fifth. You start naming the metacarpals from your thumb. 1, 2, 3, 4, 5. Okay. So normally what I told you was, what is aberrant? Aberrant means unusual, that it is not present where it should be present. Try understanding this. This is confusing. Normally I told you what? Normally I told you that once this particular thing is present, or suppose let's take thumb, it has got a head, it has got a body, and it has got a base, right? So in the thumb, normally the base is the first epiphyseal end. You understanding it? That means in my thumb, this is the exception. The epiphysis or the growing end of the thumb is its base. But in the rest of my metacarpals, the heads are my growing ends. So again, a question comes to you. Normally, what is present? The epiphyseal end of thumb is at the base. But all the epiphyseal end of my other metacarpals are at head. They are only one epiphyseal end, right? In short, in miniature long bones. So they have only got one end here, but at the thumb, it is at the base. Now, what is aberrant? Aberrant means that it is ulta. It is not the same now. That means instead the thumb doesn't have its epiphysis here, it is at the head, and all the epiphyses present here are at the base. That is ulta. So in some people, you might find that the epiphysis is of the thumb is at the, again, at the head part, and where it should not be there, and the epiphysis of the other metacarpals, it should be at the head, but no, it is present at the base. So this is called as aberrant. That means unusually present where it should not be. Now you understood, right? So this is what or how you should learn and how you should, categorize these parts. So I've covered off the different types of epiphysis: pressure, traction, aberrant, and atavistic. These are the 4 types of epiphysis, which is again a very important question for you. Right. Now, I think it is quite a long time that it stretched out somewhere, but because this is a very important topic and I wanted to go one by one into these concepts, because this is a clear-cut concept. If I go into histology straight away, you will not understand a word, right? That is why I took time in order to grain you with this concept and to grain you with that logic, why these things have been given to you in your bones, right? So I hope now the skeleton is your friend, and in times to come, you will actually enjoy it while reading it. So I want Aishwarya to come in here, and I have some kind of questions as my word rounds, okay? And I would be happy that if students take part in it.
Sure, sir. Sure, sir.
Yeah. Okay. So I have some questions. So I just want students to come in and talk and discuss it. Okay. So I have a 5-year-old boy in the ward who presented with fever and swelling. So you see this fever and swelling, and in the left arm and the shoulder. So quite probable swelling is that. And X-ray of the limb was taken. So he took an X-ray and we found out it is of osteomyelitis. Okay. And he also gave a history of fall from the bike 10 days back. Now, can anyone from the crowd explain me the reason why osteomyelitis is more common in children? Anyone? So this is how I want to ingrain that, because you will not forget it. Your whole revision will be done here.
Okay. Anybody who wants to answer can just
anyone can attempt it
in the comment section.
Why osteomyelitis is more common in children?
Anybody?
Anyone wants to give a try? I've covered this. Anything. If you want to unmute, you can talk to me, you can discuss it. Okay, I think somebody has answered.
Yes, as hairpins aren't present in adults, only in infants.
Great. So that is the exact answer. Hairpin bends. Okay, that is the catch. Hairpin bends, more common. Again, infants. You have more of these osteomyelitis in children because of these hairpin bends. Great. So great, Fatima. And I think the name is not there. So one more person has answered it. So both are absolutely correct. Okay. Now, let me take you to a case scenario number 2. Okay. So, a 30-year-old man is presented with complaints of knee pain, which is exaggerated on playing tennis and climbing stairs. Now, he was examined and he was found out to have something called as patella alta. So, just remember, patella alta is nothing, but it is a high riding patella. That means the patella should be here. Now, it is high riding. It is present here now. Can anyone explain me the reason why this bone patella is important and what is the type of bone that patella is? Can anyone tell me that what exactly is the bone? Which type of bone is patella? That is my first thing. And what exactly is the reason why we struggle so much with the patella is not working fine?
Okay, so we have someone answering as sesamoid bone, and the name is Sai Vigneshwar.
Okay.
And
Can anyone of the answers, any person can unmute and just explain me? Anyone, any student, I would be very happy if they talk to me and interact and tell me exactly how they came to have this kind of an idea.
So Sai Vigneshwar, can we have you on the mic? Can you just unmute yourself here? Sai Vigneshwar. Please try unmuting yourself so that we can have you in the mic.
Fun.
It's okay. There is nothing to worry about it.
You this is not your classroom. Don't worry. You're free to ask and you're free to. I just want to ask. I just want to interact with you because of the fact that I want to, discuss that part, and so that it becomes easy.
Yeah. So he's outside. Okay. So someone else? Anybody else?
Any particular student?
Yeah, I can see 50073AD3. May I know your name? You're answering a couple of questions. So would like to know your name. If you can unmute yourself and talk to us. Please. Hello?
Has anyone unmuted? I think everybody is here. Okay, no problem. So basically the reason is that the patella or any kind of a sesamoid bone has been given to you because rightly answered, it acts as a pulley, right? So two forces, they are more translational. If that force has to go above like this, that has to act like a pulley and that torque will be changed. That is the answer. And that will be more angular, right? So remember this case scenario. Now we come to the case scenario number 3, right? So now you are the doctor on call and I suspect a 50-year-old male to be suffering from leukemia. And I order you to get a bone marrow biopsy done. Can anyone tell me the bones which you will think to take the biopsy from?
Fariha Fatima. I think we can call her onto the mic. Fariha, can you unmute yourself?
Fariha, can we have you on the mic, please?
Good evening, sir.
Yeah, good evening. So rightly said, okay, ribs or sternum. So one point I'll just ask you, what exactly will be the type of bone marrow that you want to hit on?
Generally in the 50-year-old adult, it is the yellow bone marrow maybe.
But do you want the yellow bone marrow or you want the red bone marrow?
I think it's red actually that we want this time.
So yellow bone marrow is only in the diaphysis, right? And red bone marrow will be over on the epiphyseal end, correct? So mostly the flat bones of our body, remember like this, mostly the flat bones that are present, they mostly have all in all red bone marrow. Okay, so there are certain bones that are present in our body, and rightly said this also I missed out. Okay, there are certain bones in our body which have got solely red bone marrow. So you already told 2, ribs, sternum. Okay, so I would just give you a very simple mnemonic to it. Very sweet, sir. Okay, V is vertebrae, sweet S is skull. Again, sir, S is sternum, I is iliac crest, and R is ribs. 5 bones where you will get red bone marrow is these 5. So whenever you're carrying out a biopsy, very sweet, sir, 5 bones, vertebrae, skull, sternum, iliac crest, and ribs. And whenever I'm talking about a bone marrow biopsy, I'm talking about the red part because yellow part will only have fat. that I already told you. Correct? So are you clear, Fatima?
Yes, sir.
Right? Fine. So this is what the general dictum is. Okay. Now I move on to the fourth scenario. Case scenario number 4. Can anyone tell me the type of epiphysis this is? This particular structure, any particular one. What type of epiphysis is this? Anyone answered?
Yeah, Saish has answered atavistic.
Okay, atavistic. Atavistic is the right answer. Can you tell me that what is the name of this?
Can we have you on the mic, please? Saish.
Saish, can I have you for discussion?
Hi.
Hello?
Hello. You are unmute, but we can't hear you, dear. Hello. Is there a problem?
I think I can't hear. But
Yeah.
I think we have answered. We have got the answers already, right?
Yes.
So this is a coracoid process. I already told you that this is basically like a crow beak. So remember coracoid process. Okay, this will come to you in your shoulder joints when you'll remember. But very important, atavistic type of epiphysis, because it's very well developed in animals, not in humans. Okay, fine. Let me move on to the next scenario. 40-year-old male is diagnosed with a fracture of clavicle. Can anyone tell me how this bone will ossify? So this is how I revise and this is how I confuse you. So now you tell me how this clavicle will have ossification. So I've discussed with you intramembranous, endochondral, and membranocartilaginous. So what out of these three, what is the type of ossification which you will find in this clavicle? And I told you a mnemonic also there. Have you got the answers?
Yes, sir. We have Fariha again answering intramembranous. Vaishnavi answered membranocartilaginous.
Okay.
Kapil has also answered membranocartilaginous.
Great.
And even
so it is membranocartilaginous. Now, can anyone come over on the mic?
Vaishnavi, can we have you on the mic, please?
This is a difficult topic and I really want the students to understand and then shut the book off.
Got it, sir. Vaishnavi, it's okay. We can have you for a small interaction, please.
Oh, she's outside. Okay.
Okay.
No issues. So can anyone tell me what are the other bones that will be for membranocartilaginous? Any other bones that will have, what is that mnemonic that I told you? Think of that mnemonic. Tom's clavicle. Correct. So we have the answer. Okay. So Tom's clavicle was what? Temporal, occipital. Then what is M? Anyone? M? Mandible and S for sphenoid. Okay. As well as clavicle. So these are the mnemonic for Tom's clavicle. So you should remember this, mug it up, keep it inside your brain. These are the bones which ossify both with membrane and a cartilage. Okay. Now we have case scenario number 6. Okay. Now this 20-year-old biker met with an accident and came to the emergency and was diagnosed with an epiphyseal fracture. Okay, now you know that this is something called as a growth plate of epiphysis. And now this fracture is there and this growth plate has come out. Can you tell me the importance of epiphyseal growth plate? So let me simplify this question for you. Will it increase the length of the bone or will it increase the width of the bone? What will increase when the epiphyseal growth plate is stimulated? So
Fariha has said length, sir.
Correct. So increase in the length of the bone is by epiphyseal growth plate. That I already told you. It has got those chondrocytes, and I told you the phases. They are in resting phase. Then finally they proliferate and they mature, and then finally this hyaline cartilage ossifies. Okay. So you remember hyaline cartilage. Can anyone tell me which other part of the epiphysis will you have hyaline cartilage? One is in this epiphyseal growth plate. Any other part of the epiphysis where you will have this hyaline cartilage?
Yes.
Yes, articular surface, correct. So articular surface is the one which is forming joints, right? The head, okay? Correct, done. So this is done. Let's come to the seventh scenario. Which part in this X-ray is seen to be well formed? And what do you think is the age of the person?
Saish has answered newborn.
Newborn, correct. Okay.
Fariha
Newborn is
has
the right answer because still, I would just correct Faria here. Less than 25 is absolutely right because ossification takes place till 25. But when you're giving this, okay, till 25, somewhat things would be formed. So many age group would be there. So yes, diaphysis is formed, right? And epiphysis is not there, absolutely. So this has to be the newborn. Okay. So this is how you can, correlate these scenarios. See, now you know what all things I have been speaking about since then. Okay, interesting question. Can anyone identify the type of epiphysis marked in blue? Because this is how you will be grilling up in MCQs. You will find these kind of interesting questions.
Saish has answered aberrant.
Beautiful answer. So aberrant is absolutely the right answer. If you just see this nothing, this is just the X-ray of your foot. So these are nothing but your metatarsals, which follow the same rule as metacarpals. And if you see this thing, this is what? This is the aberrant, because again, if you see the first metatarsal, the epiphysis has to be here, but it is not here, it is present above. So now that is something called as an aberration, or normal. It is not normal. It is present somewhere else. So that is the reason that is called as aberrant epiphysis. Correct. Absolutely right. Okay. Case scenario number 9. A person is diagnosed with osteoporosis. That's a very common thing that we face, right? That where bones are not very well compact and dense, they start dissolving out. Okay, they become less hard, less dense. And the person is prescribed with bisphosphonate, which is nothing, it is a drug. Okay, bisphosphonate is a drug. And this drug targets a specific cell which decreases the bone density. That means it will stop that cell to decrease the bone density. So what is the cell which I'm talking about?
So we have Kapil saying osteoclast.
Beautiful. I'm so happy that, these are tricky questions, okay? And these are the ones which actually take you away in exams, because you see, oh my God, alendronate, this is something out of my syllabus. But the crux remains the same, right? It is just to confuse you. You know the logic behind bone, you know the logic behind what has been taught. You will answer all these questions right. Okay, I'm very happy. Now, coming to the last part, can you tell me the importance of nutrient foramen? So I'll just ask you simply, what exactly was the mnemonic in that nutrient foramen? So that you can remember the obliquity of the nutrient foramen, right, is always away from the growing end of the bone. So if it is oblique like this, the other side is the growing end of the bone. They are all opposite. So can anyone tell me that mnemonic that I told you?
Fariha has told, to the elbow I go away, from knee I
to the elbow I go, and from the knee I flee. So simply because if I just put my hand like this, to the elbow I go, right? So it is coming towards the elbow from both the sides. That means my growing end of the bone will be here and here. Just see my arm. It will be here over my shoulder, over my wrist, because towards the elbow I am going. Opposite to knee. Knee I flee. That means it will go away from the knee joint, right? Simply remember like this. Okay. So I hope that you have mastered up bone and you have started taming your bull, because this is something that you need to understand, and this is something that you should not mug up. Okay. So it's always impossible until it's done. This is always my favorite quote, because it all seems to be impossible once you start learning. Bone is half hazard, bone is so much. But if you understood it, you can tame that bull and you can become a master of it. Fine. So now I would like Aishwarya to come in and conclude today's webinar.
Yeah. So before we conclude, in the middle of the session, we had one student, Baira, who have asked a question. Sir, please repeat epiphyseal plate growth.
Okay. See, so epiphyseal plate is what? Epiphyseal plate is a junction between the epiphysis and the metaphysis. It's a plate. That plate is basically on both the sides, proximal and distal. Okay. That is on above, something that is above, that is proximal, something that is below, that is distal. Now, this epiphyseal plate is made up of hyaline cartilage. Okay, remember that. Now, what is exactly hyaline cartilage? Hyaline cartilage is a type of cartilage which ossifies very well. Okay, that's why this hyaline cartilage has been given to you there. Okay, now what exactly happens? Once this epiphyseal plate is a hyaline cartilage, this epiphyseal plate has got resting cells when a baby is born. That means once a child is born, it has got resting cells. These cells are called as chondrocytes. Chondrocytes because it is a cartilage. Okay. Now, as age goes on, there are multiple hormonal influences. And because of this hormonal influences, specifically growth hormone, it stimulates the epiphyseal plate to grow. So what exactly growth means? Growth means that it will stimulate these cartilage cells, and these cartilage cells will start maturing. And once they mature, I told you, they will ossify. So hyaline cartilage will get ossified. So what will happen? Suppose this is my pen. Okay. And this black thing is my epiphyseal plate. It will start maturing and it will start increasing the length like this. And then finally it will become ossified. And like this other end, it will become dense hard. So what we call is that wherever this epiphyseal end is growing, we call it the growing end of the bone. There might be this end also is growing end, this end also is growing end, but this end might have stopped a little earlier, but this is still growing. So which end will be the growing end? This end will be the growing end, which is not ossified till now. Now we understood, right? So this is about, in general, about epiphyseal cartilage and how it grows, the plate.
Thank you so much, sir. I hope, Baira, if you can let us know or acknowledge if your doubt is cleared, it would be really helpful.
Yeah.
Okay. Thank you so much, sir. It was an amazing session. Such a detailed topic, completing everything about bone. And I am equally happy by how the students responded to the questions also. And a lot of students kept answering. Sorry, I couldn't call everybody's name, but each one of you are the stars today, because there are people.
It's a very difficult topic because
yes.
it's something that bores everyone off, and it's something that it really perishes your concentration. But I just hope that the students have enjoyed, and I hope that once you go into your dissection labs, you start talking like this. You start seeing the bone. The thing should come in your mind. Okay, this is epiphysis. This is diaphysis. This is something that has to deal with this. This is something that has to be deal with that. So your terminologies will change now once you talk about bones.
I think, my dear students, if you can actually tell sir that the class was really interesting and we did understand everything what he taught in the comment section, it would be really good that we'll also feel happy. How did you get the class today? Would you please comment in the section?
Your feedbacks.
Yes.
And if there anything that you need to ask, and if there anything that you need to clarify, you're most welcome to ask any particular time. You can just drop a message and I'll try to communicate back, and I'll try to get all your doubts corrected. But don't keep any doubts. If there are any doubts, just ask it out. Okay. Otherwise, because anatomy is something that will keep piling up. And try creating notes. So whenever we are teaching you, just keep a copy next to you, keep writing, keep scribbling, create these diagrams, create these things, small things. When I'm telling you about a diagram, make that line diagram of a bone. And the more you practice these diagrams, the more you will start understanding, because diagrams are something which are very important. And second is, examiner will give you 5 marks more. The moment he will see that diagram, he will say, no, this person knows the answer and I'm very happy with it. Okay. You should be very confident of this, whatever you're doing. Okay. So I wish everyone all the best. And I hope that you guys keep excelling and learn anatomy and in a very interesting manner. Don't make it blurred and just mugging it up. It's a beautiful subject. Give it time. It will give you great rewards later on. Promising you.
Thank you so much, sir. And happy to know that there are students who have come for their first class and are looking forward for other sessions also. I really don't know what is your name, but thank you so much for that feedback. And please do let your friends also know about this, because we'll be coming live on every Monday, Wednesday, and Friday. Sharp at 6:30 p.m. With all the sessions of general anatomy. And you can watch the previous sessions, whatever is there covered before. You can watch the sessions in our YouTube channel, which is already done. It is already uploaded. You can have a look at them as well. And please do forward the message to your friends as well, so that they can also get these amazing sessions from our dear Sanjit sir and our dear Ryan sir. So until then, we see for
the next topic
session.
will be joints. So
Sorry,
this
sir?
is just to tell you the next topic. I'm just telling them that it will be joint general anatomy, where we will cover all the types of joints.
Yeah, you can just have a look at the textbook and come, so that the learning will be more easier and faster for you guys. So until the next session, which is on the Friday of this week, a very nice good night and bye from the whole team of Dr. Polaris. Thank you so much for attending the session today. See you all on Friday.
Thank you so much. Thank you.
Bye.
Good night.